Welcome, everybody. Hi, Mary Jane Burke here, along with Dr. Willis and Dr. Santora. So happy to have you with us today. So just as a reminder, we're now holding these sessions one time per month. And so the next session is scheduled for October 3rd, same time, 4 o'clock. So if you could put that on your calendar, that would be great. Want you to know that we'll be having an opportunity for questions. So please feel free to put questions in the chat if you have any as you're listening to the most recent update. This session is being translated into Spanish and will be recorded and available to anyone who can't make it as early as tomorrow. Michelle, could I turn this over to you real quick?
Absolutely. Thank you so much. Hola y bienvenido a todos. Este webinar se transmite simultáneamente en español. Haga clic en el botón de interpretación del idioma que aparece en su pantalla si desea escuchar esto en español. Muchas gracias a Asti Cabrera, que es nuestra intérprete esta tarde. Thank you so much.
Great, thank you very much. Welcome to everyone who's here. And I'm going to turn this to Dr. Willis right away. So here you go, Dr. Willis.
Thank you, Mary Jane. And nice to see everyone on this very hot afternoon. Today we'll be covering COVID-19 and offer an update on where we are with regards to our case rates, kind of give the status update and then where that relates to some of our school protocols, but also get into I think what is probably even more at the forefront of people's minds, which is some of the protocols and recommendations around heat. This is our current status in Marin. Next slide, please, for COVID-19. Next slide. So we are in high rates of community transmission. As you might recall, we now have two different metrics we look to. One is community transmission rates, and the other is community levels. Both of these come from the CDC. Transmission rates really relates to only case rates. So, and as you can see there on the left, the entire state of California and much of the nation is in high community transmission rates. That's any case rate of more than 100 cases per 100,000 residents on average over a week period. On the right, you'll see with CDC, we have community level, which also includes both case rates and hospitalizations, and is probably a better sort of aggregate measure of the burden of COVID-19 in our community. We are at the medium level. We were in low for a few days, a couple weeks ago, and slipped back in the medium, mainly because we had a couple more people come into the hospital. So this one is very sensitive to just the number of individuals who are hospitalized with COVID-19. Next slide, please. And these are our case rates. You can see very clearly there the waves that we've experienced since the start of the pandemic, each wave being fueled by the emergence of a new variant. That largest wave in December of 2021 and into the early part of 2022 was Omicron. And our experience since then has been really dominated by Omicron. I'll talk a little bit more about that down the road because it's exciting that we now have a vaccine that is actually specifically targeted against Omicron BA.5, which is our dominant variant now. You can see there that we are seeing a steady decline in case rates and a relatively reliable trend of a steady diminution in cases, really going back more than 2 months. Next slide, please. This is just to remind us, as the previous slide illustrated, our experience is really largely driven by what variants are emerging. And this shows there on the left, the tree, the family tree, if you will, of COVID-19, that ancestral Wuhan strain starting on the left, and then the offspring and the families that come from that. And we see lots in Marin, we've seen a lot of Alpha, Beta, Delta, and Omicron. Omicron really starting in November 21, now almost a year of dominance over Omicron. And then on the right there, you'll see how Omicron is broken down into its different subvariants. And those are the numbered BA strains that we're all familiar with. We started with BA1, then BA2. Now we are really in a predominantly BA5 chapter of this pandemic. And just wanted to make this clear that when we talk about BA.5, because sometimes we don't say Omicron, BA.5 is a sub-variant of Omicron. And Omicron is the most contagious variant. I think that's another important theme for people to recognize, that as each variant becomes dominant, it really does so because it is more contagious than the previous dominant strain. So we would anticipate this to be the continuous pattern. As we have more variants, they're probably going to be more contagious than the previous, which is why they become dominant. But fortunately, BA.5 is less virulent than other strains. That is to say that it tends to cause less severe illness on average. Next slide, please. So stepping back, these are, can help us, we're often asked to predict what's going to happen in this pandemic, and it really is a crystal ball question that is impossible to answer, but it's, I think, helpful for us to understand the parameters of what will determine the future. And the way I think about it is sort of the virus and then people, the human population and the virus. And it's really the combination of those two things that will determine our future. So first is the virus. That is how the future variants behave, especially with regards to their virulence, so the severity of the illness they cause, how infectious they are, and how able they are to escape our immune systems. Those are the properties of the virus that will be most important. We don't have a lot of control over that, but we do have control over the next three most important determinants of our experience. The next is our immunity levels, both collectively as a community and then as individuals. And that immunity is based on when we were last infected or last vaccinated or infected. So we can optimize our immunity by making sure that we're up to date with vaccines, up to date with boosters, and then also recognizing that if we have been infected, there is a period of protection that offers us as well. The next important determinant we have control over is our behaviors. Are we testing? Are we masking when we should be? Are we isolating when we should be? Or are we gathering together? And this is one of the things that as we come into the winter, we're concerned about that might fuel more cases, that we will be gathering indoors more as the weather gets chillier coming into the winter. And then finally, the resources available to respond. And this is, I think, increasingly important parameters to recognize, especially as federal budgets and others are being considered, is that we need to make sure that if we do have another surge in COVID-19, we have the testing resources, the vaccine resources, and other resources available to public health and our healthcare systems so that we can respond as communities. Because we've built a lot of infrastructure, but a lot of that is actually at threat if we become complacent and don't continue to fund new infrastructure. Next slide, please. So this is just highlighting one of those elements of optimizing our immunity, and this has been particularly one of our greatest assets in Marin County. We've talked about this a lot, is our remarkably high vaccination rates. We have some of the highest vaccination rates in the nation. On the right there, you see just the breakdown. This was recently published in the Chronicle, showing Marin had the highest vaccination rates for children ages 5 to 11 in the state of California. And aside from Imperial County, which must be spurious, there's 119. How can 119% of your children be vaccinated?
I think that's what we did in Marin County with our Latinx population. We managed that because we had higher numbers of people vaccinated, and I suspect Imperial County did not adjust their reporting.
They didn't adjust. That's right. Yeah, we cut it off at 98%, knowing that it was impossible to be able to. Regardless, we do have the highest rates in the state of California.
The competition.
Yeah, that's right.
There it is again.
I will speak more slowly. Sorry. On the left, you see our vaccination rates within 1 month of eligibility, comparing United States vaccination rates versus Marin County vaccinations for children 5 to 11 years old and children 0 to 4 years old. What you see in the solid lines there is that in the blue, about 60% of our 5 to 11-year-olds were vaccinated with at least one dose within 1 month of their eligibility. So think about that. More than half of our 5 to 11-year-olds were vaccinated within 1 month of eligibility. And that compares to about 10% for that same age group nationally. And then we are at about 28% for our 0 to 4-year-olds within 1 month of their eligibility. compared to 3% within month of eligibility for that age group nationally. So, between 5 and 10 times higher than national rates of vaccine for our pediatric population, for our school kids, which makes our schools a lot safer. Next slide, please. So now we'll get into what will be the remainder of this presentation, primarily focusing on getting back to school. This is our Smarter Schools plan. As you know, we've gone from that 30 and then 32-point plan back to just our Smarter plan, which has 7 elements, SMARTER. And Dr. Santoro will review some of the most important elements of that plan shortly, but I just wanted to start by calling attention to one of the most significant changes we're anticipating, and that is around the isolation recommendations in the Smarter plan. We are preparing to align with the CDC guidance on isolation. We were not taking that step yet to change our isolation guidance because on September 15th, Cal OSHA, who manage the regulations around staff in schools, will be meeting to discuss this as well. And then we will be meeting with stakeholders here in Marin on the week of September 19th to discuss changes to the isolation guidance. And we would anticipate updated Smarter plan on the 4th of October. But I'll just briefly, next slide, I'll just briefly go over what is being recommended. So this is what the CDC says about school isolation guidance. And this is from January of this year. And they say that all people with COVID-19 should undergo isolation for at least 5 full days. As teachers, students, and staff test positive for COVID-19 but don't have any symptoms should isolate for at least 5 days. If symptoms do develop, day 0 would be counted as the first day of symptom onset, and then day 0 is the day of symptom onset, and day 1 is the first full day after a symptom started. So then 5 days after the development of symptoms before people could return to school. Next slide, please. So again, if you had no symptoms, you can end isolation after day 5. If you have symptoms, end isolation after day 5, after symptoms begun. If you're fever-free for at least 24 hours, symptoms are improving, or if you have fever or other symptoms will not improve, you need to continue to isolate until they improve. Again, this is the reviewing the CDC guidance that we will be recommending we consider here in Marin moving forward. Next slide, please. So after students and staff return to school after day 5, they would need to continue to wear a well-fitting mask around others at home and in public until day 10. So we call this the 5 and 5 protocol. 5 days at home, 5 days with the mask. If unable to wear a mask around others, continue to isolate for 10 days. So we are proponents of the 5 and 5 plan. California Department of Public Health still recommends that people test out, that you need to have a negative test up to 10 days out before you can return to school. And we are in the process of revising our standard for Marin County, again, in this timeline that I just offered following that Cal OSHA meeting on the 15th. Next slide, please. So for now, our isolation and quarantine guidance is unchanged. It is what we've seen, what we have published, and is consistent with California Department of Public Health guidance that an individual can return on day 5 or later with a negative test, and only with a negative test and symptoms resolving and no fever. Isolation can end on day 10 regardless of test results. So basically no need to continue to test after day 10. If symptoms are better, they can continue to, they can return to school. Next slide, please. So that was just the review of the anticipated change around our isolation guidance. I'm going to hand it over now to Lisa to talk more about the Smarter plan.
So our anticipated change really is predicated on the layers of protection that we have in school, knowing that isolation is just one layer. Dr. Willis already described how we have very high vaccination rates in our community that has us exceeding most counties in the nation. And most counties in the nation are already following CDC guidance. California has successfully been more conservative in their approach, and though we see Marin County prepared to lead again and to relax our guidance to allow students and staff to return to school. Again, Cal OSHA does inform what is allowable for staff, and we'll be closely following any updates from Cal OSHA. But even if Cal OSHA does not update where it relates to staff, we will still be considering updating our guidance on October 4th for students to return with more relaxed guidance. Really going back to what we said when we last met, it's just the critical importance of students being back in school and really focus on the social and behavioral health of our students, and knowing that while COVID still continues, we can mitigate that risk. The next step in that mitigation really are masks. Masks will play a really important role if we do adopt CDC guidance for our isolation. We will be reinforcing the importance of wearing masks not only after you've been exposed to someone who's tested positive for COVID, but also if you're returning to school after having an infection with COVID. Ventilation remains an important tool for us. We've seen throughout these last 3 years that COVID does not like the outdoors, so bringing in air when it's not too hot from the outside indoors is a critical tool for us. Testing when you do have symptoms. We are still having people, and I'm sure you're out there, people that have just tested positive this week. That's why our transmission rate remains high. We are seeing people that were infected with Omicron 1, the BA1 variant, now becoming infected with the BA5 variant, which is why shots will be critically important. Again, that bivalent booster will be available in our community. Dr. Willis is going to talk a little bit more about that in a little bit. Isolation is a important tool, especially those first 3 days after you've been infected or when you're most infectious. So staying at home for those 5 days offers that a longer window of protection. And then there are individuals, not our students, but our staff, that would potentially benefit from having access to Paxlovid if they do become infected with COVID-19. Jump to the next slide.
Can you stick on this slide for 1 second? I'm sorry.
Go ahead.
This is a nice mental model for, the idea of the Swiss cheese is that, if you get through the you're vaccinated, it's going to, the virus is going to bounce off right off the bat there. But you're less likely to be infected. You're less likely to certainly get seriously ill. But if the virus does kind of sneak through that layer, but you're wearing a mask, the virus might bounce up against that mask and stop and not lead to any more infections. If there's somehow some of those, sneak through the mask, you got the ventilation thing that's going to improve your risk profile even better. If somehow the virus sneaks through both shots, mask, and ventilation, with testing, you're going to add another layer of protection, and then isolation again. So the idea there at that individual on the far right there is actually not getting any of the virus because of all those layers upstream. And I just love this way of thinking about it, because people get hung up on one or another strategy, and it really is the aggregate, the sum total of all those strategies that lead to the greatest protection overall.
And I think we discussed this beforehand, is that our vaccination rates also, to me, are a proxy measure of how good our community is at following public health guidance. So we have high vaccination rates, and that is probably reflective also of other protective behaviors in our community. Staying home when sick, wearing your mask, especially if you've been exposed, and those are all at play. And again, as we're looking to October towards relaxing our guidance, knowing that all those layers of protection are at play, especially so in a highly educated community like Marin County that has high vaccination rates. I love the misinformation mouse, though. I didn't notice it until our team did
It's eroding away, those layers.
So that's why we have presentations like today, is to keep the misinformation mouse.
It's there's no misinformation mouse on shots. I feel like that's where it really is.
No.
Yeah.
That's sort of like
So we need a mousetrap.
All right, so you can jump to the next slide. So again, as we approach relaxing our guidance around isolation, that's where masks do remain an important tool for us. We still recommend wearing a mask when community transmission is high. It is high, but we also know that people have relaxed their mask behaviors and know that individuals are, after infection, they know their immunity is high, and they're making an informed decision about not wearing a mask. And also, again, seeing the benefits of not wearing a mask just with that social interaction and supporting the learning environment. That being said, we know staff are exposed to a large number of students all day, so really encouraging staff to continue wearing their mask, especially a KN95 or greater if they're in that classroom with multiple students, and especially if you don't know their COVID status. You can jump to the next slide. Again, I guess we're really reinforcing masks. So we're going to be relaxing. We want masks to be at play in our community because they are protective. And again, just the top bullet is the language that CDC is really leading with now, is that anyone with symptoms, we know there's different symptoms, should be wearing a mask. If you have a positive test, you should be wearing a mask, and that last reminder, if you've been exposed to someone, especially if you haven't recently recovered from COVID-19, you should be wearing a mask as well. Jump ahead. Shots, do you want to take the shot slide?
Sure. Yeah. So the exciting news in vaccine land is that we have a new vaccine. This is probably the biggest single step forward in vaccines since the vaccines first arrived in December 2020, because the latest vaccine is actually specifically matched to fight against Omicron BA.4 and 5. Those are the dominant strains now. They are likely to be the dominant strains through the fall. If anyone in Marin County is infected, if any of you are infected in the next couple months at least, it is very likely to be with a strain, the BA.5, that this vaccine is really well designed to prevent infection. So we're recommending, it's now eligible for the Pfizer vaccine for anyone above age 12, the Moderna version for anyone above age 18. We're recommending that anyone who, especially if you haven't had a booster shot in the year 2022 or haven't had an infection, it's kind of a no-brainer. Go ahead and get that shot. Especially, we're really promoting for our oldest residents and those with chronic conditions, but it also protects our children as well. People who have been infected in the past 2 months or have had a vaccine in the past 2 months, we're recommending they go ahead and wait until that 2-month interval is passed before they obtain the protection of the vaccine, because it's really, it's very likely that you were infected with the BA.5 strain that is circulating now, so you're probably very well protected currently. And because immunity wanes a bit over time, it makes sense to wait until that immunity that you gain from that prior vaccine or infection wanes a bit before you get that extra boost from this booster. This is going to help keep our schools safe through the fall and winter. Obviously, we're concerned every year. We've seen increases in cases over the winter time. We've seen appreciable surges in cases following, fall holidays like Halloween and Thanksgiving and Christmas, and the winter holidays, and that's largely because people are together more. There's travel associated with people together indoors more, and there's more transmission. So really coming into that with the protection of the vaccine will allow us to travel and gather more safely. And we know how important that is, especially now as we're coming into our third holiday season under the shadow of this pandemic, and recognizing how important family and relationships and gatherings are. Let's do that as safely as possible by obtaining the protection of the new bivalent booster vaccine. It's available in most pharmacies across the county now. They're already administering it. You can just go ahead and sign up for an appointment on our website or on the pharmacy's website. Kaiser is offering this vaccine to their members. We also are partnering with Safeway to have vaccines available at the Northgate Shopping Center. As soon as there's enough doses available, right now there's only a few hundred available week to week, but that's going to increase significantly next week and the following. So we're hoping to have enough vaccines to do up to 700 doses a day at Northgate. So supply should not be an issue, and we're really hoping that our community takes advantage of this the way we have every other vaccine as it's rolled out. Do you have anything you want to add to that, Lisa?
Jump to the next slide. Just to add that this bivalent vaccine is going to offer significant protection because it has both that archetype virus, the one that we emerged out of China in the beginning in 2019 actually, and then it has the BA.4 and 5 bivalent combination, and that's going to offer protection. And the other thing is just to be aware that we're going to have a differential vaccine experience globally, because in European countries, they're going forward with the vaccine that has the BA.1 and 2 variants. So we used to look really closely about the protection offered by vaccine and look to other countries. And for the first time, we're actually going to have 2 different vaccines circulating as the bivalent vaccine. We definitely support the recommendation to have the most updated, most widely spread variant included in our booster shots in the United States. We do think that's going to offer us the best protection There was a small delay in getting that widely distributed, but if you really think about the speed of this vaccine distribution, it's the fastest that I've ever seen. There's been some concern around that there not being human research studies. Basically, there has been research studies on the bivalent vaccine that is being produced by Moderna and Pfizer, but it was on a group that had the BA1 and 2 variants as part of the booster. And so we do have some studies. What they did is they just substituted out the BA4 and 5 proteins, that spike antigen for the BA1 and 2 that did have clinical research. So there have been clinical studies. There weren't specifically on the BA4 and 5, but right now we have research in vivo as that vaccine is distributed, and we are not expecting to see a different safety profile that we've seen with past vaccines against COVID. And I think this is where our community is just going to be adapting to a COVID booster like we have for the flu booster every year. So I think this is now what we're seeing is the this transition to how we experience the flu boosters or the annual flu shots. And what we see in uptake there is typically 50% of our community does get the annual flu shot across age levels. And so we'll be closely following to see what is the bivalent booster uptake in our community and reporting that back to everyone. So the appointments that Dr. Willis mentioned are on the website. You just go to our coronavirus.marinhhs.org/vaccine and vaccine finder, and Marin in Google search will get you there too. So we hope everyone is, again, seeking their vaccines. I had an email from a constituent that was trying to get the vaccine before travel, and they were able to get a vaccine at one of our local pharmacies. So they are now available for people, and just the prioritization that Dr. Willis mentioned is important. Jump ahead.
I got one more bit on that. So that's the S. That's S for smarter. Our shots is S. To your point about, because I have had questions about whether or not this was adequately studied, because it happened so quickly, which is a huge asset for us. It's really great that we're able to keep up to date with these variants, and I think this is a harbinger of, it's very positive for us in terms of our future response to know that we can, as variants emerge, that we have the technology to be able to mount a vaccine that actually matches that variant will help us, will help sort of diminish the overall impact and severity of surges in the future. This is also how the flu shot works every year. So the flu shot has been tried, the clinical trials to determine the safety and efficacy of the flu shot happened years ago. And each year the flu shot is basically the same mechanism, the same machinery, the same mode of delivery. What changes is just substituting out a few little elements that actually relate to the flu strains that are circulating that year. That's exactly what we're doing now with the COVID-19 vaccine. So we already have a model of safe and effective, but variable and adaptive vaccines out there in flu.
Okay, jump ahead. So this is just to point out, we'll be sharing the PowerPoint presentation, but you'll have a link to our isolation, quarantine, and travel guidance. There are no specific restrictions on performing arts or other outdoor activities or sporting activities. We're just working closely with outbreak management. And then we'll just start referring our schools to CDPH's Smart Events Playbook just to create the safest possible event. Right now, not today, but on days that are cooler, outdoors are always better. So if there is going to be a large gathering of more than 100 people, the more time that can be spent outdoors, the better. There is still high community transmission, so you need to be prepared if more than 100 people are in a room, at least one person is testing positive and infected with COVID-19 at that event. So just be prepared, but that's going to drive transmission. So if you can get outdoors on cooler days, go outside.
Lisa, has there been any new definition of what an outbreak is, or what is an outbreak right now?
So now with outbreak, it's more than 5% of a school being absent or a classroom being absent. So we are looking school to school based on the enrollment at each school to determine what an outbreak is. It's no longer just 3. We used to have a very tight definition of three students or 3 persons on a school campus that would be considered an outbreak. Now the cases that we're monitoring is when it's more than 5%. But there could be a smaller school, it could be less than 5%, and we're checking in with all of our schools when there are positive cases, so we can just make sure there is no specific incident, be it like travel or other gatherings that might have precipitated a smaller outbreak. Jump ahead. On to heat. So we are in an excessive heat warning, and this is, again, climate change is our reality, and we are seeing higher temperatures than we've ever seen before in this area. So really pushing us to accelerate our planning and response activities. So we really are encouraging people to avoid being outdoors as much as possible. We know it's really hot, especially between that 3 to 6 time frame in our community. The best thing to do is, if you have to be outdoors, is to stay hydrated. Hydration is that key tool that we all have to protect ourselves when we don't have access to air conditioning or other cooling resources. And then also considering canceling or rescheduling those outdoor activities. We know sports are going to be a big deal for our schools as they navigate through the heat. So schools that are continuing with outdoor activities, and that's okay if they can't cancel them. You have outdoor activities, making sure that there's more break times and making sure students and our student athletes are getting hydrated sufficiently. That should be sufficient to prevent heat exhaustion and other heat-related incidents in our younger student athlete population. You can jump ahead. That being said, we are going to be looking at a new profile. It's called the heat risk profile, where we're looking specific. This is providing more information about specific geographies rather than just an alert or warning. It's trying to really inform us what is the risk. And what this heat risk profile looks at is other factors, including the overnight cooling. So one of the best things I think we've all experienced are when we open the windows after 7 o'clock at night and all of a sudden the cool air rushes in, and that allows our bodies to recover, having that overnight cooling air. Wasn't as cool last night as it has been in the previous days, so we didn't recover as much. But this is really trying to have a more geographically specified response, so we're not shutting down the entire county when we're having a heat emergency, but really looking at the different risk profiles that are happening in our community. We're going to be partnering with the Office of Education to see to align our heat risk potentially with the different school-specific or sports-specific guidance we would give, almost like we do with air quality. We have smoke guidance. We'll be looking to develop heat risk guidance that relates to schools. Before that happens, you can jump to the next slide. There's general guidance that we have based on the heat risk. So the high risk is when heat-related illnesses are could happen for the general population, especially if there's little to no relief at night, if we're not cooling down at night and people don't have air conditioning. So again, hydration, hydration, hydration. I can't say this enough. Most of us underhydrate. We avoid drinking water, just like we avoid washing our hands for some reason. I don't know why, but we don't hydrate enough. I'm one of the most guilty parties out there, not with hand washing, but with hydration. But again, you can wear light clothing, avoid those outdoor activities, especially wait till it gets cooler. And if you can, be in an air-conditioned space. We did activate our cooling center at the Kerner campus down in the canal area of San Rafael. It's the first time we've activated that in that location, and we'll be seeing how useful it is. The challenge, honestly, for most heat-related incidents is that it really are those who are shut in their homes and don't have access to cooling in their homes and have severe chronic illnesses like poorly controlled diabetes, end-stage renal disease. So those are the populations we're really concerned about. Also, there's populations that have to work outdoors, like our outdoor staff who are gardening outside. Again, a critical tool, not only just finding shade and taking breaks, but again, staying hydrated. And our younger populations, that under 5-year-old populations, could be really vulnerable. And that's why we'll be looking in partnership with schools if they do close because of learning, their learning spaces aren't sufficiently air conditioned, having partnerships with schools to keep some air conditioned spaces open so families with young children can have a space to cool down. We know there's parts of our community that have crowded housing and living conditions, and want to make sure that our most vulnerable populations have access to air conditioned space. Anything before I jump to moderate risk, Matt?
Just to put a pin in this, so what we're talking about is a new metric, a new index, right? So we've got our COVID-19 community transmission rate index with the colors now, and we have our wildfire smoke index with the colors. It's the same. This is green for no risk, yellow for minor risk, orange for moderate risk, 3 for high risk, and then purple will be very high. And this is what we just reviewed as the high risk. And just to, as an example of how we might use this in schools moving forward, in high risk, actions to take says avoid outdoor activities between 10 a.m. and 4 p.m. So that's the kind of thing that might translate into a recommendation that when we're in that red high risk, that we not, kids would be not out on the playground, or that practices may be canceled, to sort of link it to what's already established within these guidelines.
And so my children ate their lunches inside today. So it was a great choice. They enjoyed it. It was cooler for them to be inside. They didn't miss their activity outside, especially after they went for pickup and saw how hot it was outside, and definitely appreciated it. We know all schools do not have those air conditioned rooms. And again, that's why we'll be partnering with schools to help them provide the best guidance to support keeping kids in school during smoky days, during hot days. And also, again, if we do have to close, providing supports for families who need access to air conditioned space that some locations and schools might be able to provide. Jump to the next slide. So most of our county are actually right now is in moderate risk, and those are the populations that I described earlier are at highest risk for older adults, but it also does include athletes, and that's why we really want to have good messaging for sports that continue during those moderate heat risk days, really making sure kids can rebound, but they really do need to be hydrated, and those water breaks need to be increased in frequency. And so that's it for our high and moderate risk. So we'll be developing guidance focused on that.
One more point about just heat. When we look back at when heat waves have led to bad outcomes, people being hospitalized and people passing in the past, it's generally a few days into the heat wave, like the Great Heat Wave in Chicago in the 1990s. Day 3, day 4 is when we really started seeing that more severe morbidity and mortality. And it was really most, aligned with, unfortunately, individuals who are socially isolated. So especially older people who are living alone, who may not have had a social network around them, someone who would reach out to check on them, make a phone call. One of the most protective elements was actually people who were in like faith-based communities or other social networks where people were actually looking out for one another. So that's just another reminder of how important it is, how interconnected we all are, and how important it is to look out for each other. So if anyone has, someone in their life that they know is maybe living alone or might be at higher risk for heat-related illness, now is a good time to make that call, and just or do a well-being check and just kind of keep an eye out for each other.
So the next slide that you'll see, you'll just have the links to our resources. And the first one is Marin's own Office of Emergency Services has its emergency information. It's where when we get updates from school about school closures or updates about schools opening, cooling locations for families, we'll be posting it to that website. And I spent a lot of time on the second link, which is our National Weather Service, just tracking the weather information. So that's another great information source for our community. Jump to the next slide. I think the next slide is our last slide. And I share this with my kids all the time. It's not our muscles that makes us strong, but it's our responsiveness to change and being adaptable. And we really are being challenged now by climate change and looking forward to making those responsive changes, not only in cooling centers and other places, but looking at how we can be more adaptive and preventing decreasing the frequency of incidents like this in the future. So we are adaptive creatures, we have learned. So thank you very much.
Great. Okay, I do want to call out just for a moment for everyone that one of our districts, the Novato district, actually a couple of years ago did develop an actual heat plan, and essentially to decide what to do in the event of a situation like this. So kudos to our largest district, Novato. And at this point, we are now going to be looking at this document to see what pieces of this might be included in a recommendation countywide so that people know what to do. So in the case of Novato, by way of example, they have a couple of schools that are not, in fact, they do not have air conditioning, so they knew that they would be running a minimum day, by way of example. And then just to make note that what Matt and Lisa are referring to is I wonder if the schools that are now minimum day, do they have any space at their school site, for example, a multi-purpose room or whatever, that had air conditioning that we might be able to use for our families in a different way. And for all of you, this is no different, or different issues, but no different than the way we've approached so many of these issues, i.e. learning pods for kids when schools weren't open, so they had a safe place to go with supervision, food, access to technology, a daycare opening during the air quality issues. So I think we have something to draw on. And in this case, I just wanted to thank Novato for their foresight. So thanks to Novato. So let's go ahead and go into the questions. Mike, can you help us here?
Yeah, so the Q&A is fairly quiet. There is a specific question about heat. Shouldn't schools be canceled in extreme heat conditions? This might be especially important for children with respiratory or cardiac conditions.
I think of the language that we saw in the Novato plan, and we saw it throughout these past 3 years, as schools are the safest place and some of the best place for students to be during days that we would consider hazardous. Of course, and again, I'm stealing from Novato, parents have the discretion to keep children home at any time, especially if they're concerned about the well-being of their children due to heat exposure. So parents have and guardians have that discretion. But for many families, especially our low-income communities and communities of color in Marin County, do not have access to air conditioning in their homes and may be living in crowded housing conditions. And so having school doors open is critical to their well-being. So I think it's both. I think parents have the discretion to keep their students home if they're worried about high heat or air quality affecting the well-being of their children. And then I also think schools are the best place for kids to be on some of those days. We have many working parents, and having students in a school where they're supported and can thrive and adapt and navigate the conditions by eating indoors and other adaptations that schools can make to keep their school community safe. So I would say on the whole, we do not want to see schools canceled or closed on poor air quality days, or even if there's a disease outbreak, we're going to try and keep schools open. And again, also with high heat days, we want to keep schools open as much as we can safely to create safer environments for all students in Marin County.
And in this case, the majority of the schools in the county are actually air conditioned.
Mm-hmm.
So for some of our families, they're coming from a house that's not air conditioned to a school that is air conditioned. So that, as in the case of Novato, this is not the schools of Novato. It was a few of the schools that didn't have the air conditioning. So I think that would be, so this would not be some countywide situation. Yeah. For sure.
Yeah, and just, I think COVID taught us all that when we think about closing schools, the mental model is what is the alternative? What is that child then experiencing? And as Lisa says, if we're closing schools in certain parts of Marin, you're basically potentially sending a child back to a home that may not have an adult present, may not have any air conditioning, and they're far better off in a structured environment where their heat risk can be managed alongside all the socialization and everything else we know goes along with being in school.
Okay, and at what temperature in the classroom should we be concerned?
That's a great question. So
What number?
Yeah, that was the question from the audience member.
So
yeah.
ideally, we want to keep temperatures less than 78 degrees. That's the reality. And I think what some of our schools are probably seeing, if they're on air conditioning, they do not have access to air conditioning, might be seeing temperatures greater than 78 degrees. So I think what we see typically, and I think that's where we need to be engaged in advanced planning and to a greater degree in Marin County. We have been seeing increasing frequency of these heat events, and it was exciting. I was on a call with San Rafael City School District earlier, and some of the improvements they've made in the school had them with some support from their community, has had their entire schools didn't have to close because of having air conditioning support. So I think those are conversations we need to take a look at, take a catalog of all the schools in our community, see what classrooms are going to be able to maintain that 78 degrees, and then provide recommendation to those schools.
Yeah, I mean, from a physiology standpoint, body temperature is 98.6 degrees. So when you get above that, it becomes challenging just to sort of, in the absence of any other mechanism, to manage the increasing core body temperature, where you started getting into territory of hyperthermia, heat exhaustion and then heat stroke. So that's one specific number. Even above that degree, if you have water available, if you're, the way that we cool ourselves is through evaporation. That's the reason that we sweat, that there's moisture generated and then it evaporates off when it comes to keep our bodies cool. You can reproduce that with cold water. So even when it's very hot, if you don't have air conditioning, most of us have access to cool water. And it's very effective at actually managing body temperature, just to have a cool rag, wiping cool water on your body, keeping a cool rag around your neck, especially if you have a fan blowing air at the same time, you increase your evaporation. And it's like having air conditioning. So those are, rather than coming up with a specific number, I think recognizing that we can actually manage extremely high temperatures if we have access to some of those other resources and understand how to use them.
And just including fans, I think that's something that we've also seen community-wide, is that fans, not necessarily just air conditioning fans, can be really effective. So we'll be learning how to adapt together to this new challenge.
Great, thank you. And there was one more specific question that came in advance about how lunch at school should be handled during extreme weather. I think a parent observed at a local school, students eating outside in the heat of the day. Is there a concern about eating outside when the temperature is high?
Yes. Yeah, I mean, shade, is important, and indoors provides shade. If you keep the lights down, keep the blinds drawn, increase ventilation where you can. If it's less than about 96 degrees, you're better off actually having kind of the ventilation blowing through. And then those other strategies I mentioned in terms of using water to cool off. That's an example of the kind of strategy I think that we would define with regards to the metrics. So if it might be something like when we're in red, that we recommend that all meals be, occur indoors and children not go out onto the outside to eat, or moderate, or or temperature cutoff.
Okay, well that kind of wraps up the questions in the current Q&A. One thing, Dr. Willis, that you said around the new bivalent vaccine and the initial limited availability, but at some point we'll be getting to, we're anticipating up to 700 a day capacity at Northgate Mall. How much time will it take us, do you anticipate, before we get to that level of eligibility?
Well, there's, right now pharmacies, national chain pharmacies in Marin do have open appointments. And, your healthcare provider, especially, half of our covered lives are Kaiser residents, or Kaiser members, and Kaiser has doses as well. I would say in 2-3 weeks, we would be up to 700 doses. I think it's right now about 400 doses a day at Northgate. So supply should not be an issue even now. And we'll have more over the next couple of weeks.
One of the issues that's come up is related to some of our students that have not kept up on their regular vaccinations. Can you talk about that a little bit and how that does interface or not with the COVID vaccinations? So the first thing is you can get your regular vaccinations with COVID. So all of our students are required to be up to date with their vaccines. COVID-19 is not a required vaccination to attend schools, but other vaccines are required to attend schools, for example, measles. And so all students who are attending school right now, our nurses are working really hard and school staff are working really hard to get those vaccine records, especially if there's those transitional grade levels that you need to update those vaccine records. But we've seen that on whole as a state, we've seen people fall behind in getting their regular vaccines just due to delays in accessing care. So now's the critical time to visit your healthcare provider, make sure that you're up to date with your children's vaccinations, and make sure that you're making it easier for school staff and providing those documents that are needed, especially during those 5th grade, 7th grade, and 9th grade are the years that you need to make sure your vaccines are up to date. Is there a problem getting a COVID vaccination and a flu shot?
No, you can get them on the same day.
You can?
Thank you, Mary Jane. That's it. We should have said that.
She's another person who got her public health.
Yeah, it's those are the two respiratory threats this coming into the fall. We're already seeing increase. Flu season has been odd over the past couple of years because of COVID and people have been interacting in ways where flu's been transmitted. But we're actually seeing this is probably going to be just a normal, flu season where we would expect to see classically see increase in cases. We're already seeing increases in cases of flu. So the flu shot and the COVID-19 bivalent booster are kind of the recipe. And most of the vaccine sites I mentioned, Northgate, our pharmacies, Kaiser, are able to provide both the flu shot and the COVID vaccine at the same time, and there's no reason not to, and it really leaves you better off for the whole fall and winter.
And the last thing is that we're waiting to see the 5 to 11-year-olds. So you're 12 and above can get that booster, the COVID booster and the flu shot, and we'll be waiting to see. We'll be providing information once we hear around most likely Pfizer would be the first vaccine approved for booster approved for the 5 to 11-year-old age group.
If you had a young baby, at this point, would you have them get their shot?
So flu shot would be recommended.
Not flu shot, the COVID shot.
I think that's where we've been encouraging families of the 5 and under sex to talk to their healthcare provider. We see very mild illness for the 0 to 4. 0 through 4 group. What is unknown to us is the long COVID. So we've seen a lot of the parents who were early adopters of the COVID vaccine for the 0 through 4 years old were those parents that were concerned around long COVID, and it's a big unknown for us.
Sure.
So our encouragement is for everyone 0 through 4 to talk to their healthcare provider around the COVID-19 vaccine. Marin County Public Health strongly recommends everyone 5 and older to get vaccinated against COVID-19.
Okay, with that, I think there's a wrap, right? So thank you very much. Liz and Matt, we appreciate it more than anything, the support you've given us for now so many years. It is a wonderful community that we live in with partners, is described, right? Collaborators, they're working together in order to do everything we can to keep the entire community safe. And of course, with a special focus on our students and their families, particularly those that are most vulnerable. So thank you very much for everyone for participating, and we look forward to seeing you on October 3rd at 4 o'clock. Thank you.
Thanks.